A new study is helping us understand how women of different races have different experiences with menopause. And it's now making some question how treatment options are offered to African American women. To explain these disparities, Dr. Makeba Williams joins us. She is a Washington University OBGYN at Barnes Jewish Hospital. So first, what made you want to look into this farther?
Well, Paige, there is increasing recognition that there is disparity in women's health. We've talked a lot about this from a maternal health standpoint. As an OBGYN who focuses on midlife and menopausal health, I wanted to understand what was the continuum of the experience for women once they reach post-reproductive age.
And what did you find?
Well, we found that there is not a universal menopausal experience. How we have approached the treatment of caring for menopausal women has largely been based upon a universal notion based upon the experiences of white women. We found that African American women had more severe, frequent, and a longer duration of those bothersome hot flashes and night sweats that many menopausal women talk about. We also found that there is more sleep disruption, and there are some treatment differences that African American women experience.
That begs the question why different treatment options may be presented or not be presented to different groups. Were you able to uncover any of the whys of this?
Sure. There appears to be some cultural influence as well as just a lack of willing to address menopausal symptoms. So we know that we just don't talk a lot about menopause. And so African American women are less likely to initiate discussions of menopause with their healthcare providers. That may give this perception that they are less bothered, more tolerant. And so if the patient doesn't bring it up, the physician often will not bring it up. And the problem there is when you're not treating patients for their menopausal symptoms, they can have worse health outcomes overall. So that just further leads to healthcare disparities amongst African American and other women of color.
So now that you have this body of research really revealing important information, what do you hope happens next?
Well, we want to have those discussions happening in our healthcare spaces. So we want physicians, healthcare providers to be aware that there isn't a universal experience, that African American women experience these symptoms longer, they are associated with worse health outcomes. And we also want African American and other women to begin to have that conversation so that they can get the care they sorely need.
Yes, such an important and relevant topic for so many of the women watching right now. So Dr. Williams, thank you so much for joining us to help us learn more.
Thank you, Paige.